Obesity has been considered and called the rising epidemic in our country. And while there have been organizations who have called for change and support, there haven't been a lot of voices who have been there for the individual. And that is where Kristy Kuna's group steps in. And it is very important for us as we think about our over-the-road drivers to think about ways to support them and give them a voice in this aspect of healthy trucking.
Absolutely, and it is all about support. Our organization is called the Obesity Action Coalition, and we are the only national nonprofit that exists to represent the interests and needs of individuals who are impacted by obesity or any weight-related illness. So we are unique in that respect because in 2005 we were developed, and before then there was no individual or no place for individuals to come to demand change when it comes to education, awareness, prevention, treatment, and overall advocating for the person. So there's a lot of issues that surround not only the fitness and wellness and nutrition aspects, but in the issue of people who are impacted by obesity or any weight-related illness. That person needs to be represented, and the OAC is the only organization that does that. So we are excited to really focus our efforts in the trucker community because the need is there. We know the need is there, so we're really looking forward to being able to serve that population.
Well, let's talk about that. Let's talk about representing this population, our over-the-road drivers, and thinking about ways that the reason that you identified over-the-road drivers as a place where you all could make a difference.
Well, absolutely. You know, with truck drivers, we recognize that there are differences when it comes to what their needs are. You know, they can't respond to the typical eat less and move more mantra that our society really puts forth as the only solution to impact weight. A lot of folks we know, vast majority of us struggle with weight in many shapes and forms, and with anywhere from being obese in the obese category to severely obese. I mean, there is a broad range of individuals, and we know prevention is important, but we also know that these people need help and they need to know the right strategies in order to address their weight. So our organization isn't dedicated to telling people or telling people you need to be doing this method to impact your weight or to be fit and healthy. We are an advocate for giving folks all of the options out there that are evidence-based and the factual things, because the tough thing in the weight industry is that there are so many diet plans and fad gimmicky products that are out there that unfortunately people get preyed upon to do that, and the Obesity Action Coalition does pride itself on evidence-based strategies. So the resources that we provide to folks for free as a charity all are centered around those principles, and it's important to us to make sure that we maintain that message of evidence-based and factual information to lead the person who is in this sea that's trying to navigate the right things knows where to go.
Well, let's talk about that for a minute. If someone is listening, watching, and they think, that's me, I need that support, I need that research, and yet this is a sensitive topic for me, I'm not sure how to begin. How can they use your resources to their advantage? How can that over-the-road driver access your help?
The great thing about our organization is that while we exist in a tangible form, we also have a very strong online presence. So we have just dozens upon dozens of educational resources in print format, as long as hundreds of articles on any weight-related topic you could really think of. But the great thing is everything that we do is online. So you can access any brochure, any article we've ever done, accessible in a PDF form online, and you can read that at your leisure and get what you want out of it. If you need that little extra support, you can contact us and we can connect you and to get you involved in more in the care. If you're looking for resources and trying to find who are the doctors that specialize in weight loss, I want to see a physician, I'm going to be in this area, we can point them in the direction to do that. So there are so many ways, and I think that folks in general don't understand there are so many different options out there. It's not as simple as, we know it's not as simple as eating less and moving more. It's a strong component in any type of health and wellness program that you engage in, but for the vast majority of folks, we know that they need a little bit extra, they need a little bit more support, and so our organization is designed to do that for folks. So online resources for us are crucial, especially in this population. easily accessible. Everything's mobile friendly, so they can definitely go online and do that as well. So we welcome that. We welcome them to share our resources. We have a very active social network as well, and it's a great place to be, to really not only get the education but get the support that you're looking for people who get it, for people who understand that it's not as simple as our society makes it out to be. Because if it was simple, we wouldn't have the problem that we do. So we know that.
So I hear you saying information, research, option to individualize the information that you get, and ability to do social media to follow so that the information follows you.
Absolutely. And to connect and engage in that information, because we find that the most successful ones and those who really stick with it are those who remain connected and remain a part of something. And that is really what is at the center point of all of this, is that people want to feel supported, and that goes especially in our community.
And Kristy, when you think about the people who have been successful utilizing your services and the services of the coalition, is there a story that comes to mind?
Oh my gosh, there are so many stories. I have the blessing to be the director of membership, so I get all the direct interaction. One of the members that comes to mind specifically is a woman named Sarah. Sarah's from Florida, and she is a person who's impacted by severe obesity, and she has this mantra that she was born to be that way. And what's so compelling is that she actually has a compounding condition that causes her. So you hear a lot about folks that it's a genetic component, there are certain conditions. Well, she's an example of one of those where she has been through such a challenge in her life, and being a person who's been affected by severe obesity, being discriminated against. She actually lost a job because of her weight. A little bit different than the truck industry, where we know they have to face regulations, and that is a big concern, so we understand that. But this individual was really directly discriminated against for her appearance. And it's tough for us to really swallow that sometimes, because we want to live in a great society where judgment is not part of it. Unfortunately, with weight is probably one of the most acceptable forms of bias and discrimination in our society. There's so much science behind it, and it's so fascinating, but it's also heartbreaking. But this individual really kind of came to terms with the fact that even though she'd had an intervention of actually had surgery in order to address her weight, but she still lives the life of someone who's severely obese, and understands that, but no, her health is better off because she has lost hundreds and hundreds of pounds because of intervention, but is somebody that still struggles to this day with bias. Bias is one of the pillars of our organization, because we know that those who are facing these issues, they face bias every single day of their lives. It's just it's not understood. We can't understand exactly, but we also understand the perceptions are there. The public doesn't understand what it means to be someone who's impacted by excess weight or obesity or severe obesity. And one of the most profound things I've heard people say is that couple things is that I've never met anyone who's decided to be this way. So yeah, I don't know anybody who would choose to have this disease, and it is a disease. It is something that we recognize as probably the most complex chronic conditions or illnesses that is out there. So it's not easily understood.
And Kristy, when I think about the regulations that our over-the-road drivers do face, which supports on your website would be most important for them to consider?
I think that simple message of a 5 to 10% weight reduction is very impactful on health. We advocate for that. We obviously know that, with the general message of what we convey is your weight matters. So no matter where you are in terms of if you have a small amount of weight to lose to get into a healthy category, to maybe hundreds of pounds, which we deal with a lot of folks who do, because it's a reality. That simple message of your weight and health go hand in hand, and simply looking and measuring what is your BMI. A lot of folks don't understand body mass index. It's not a perfect measurement. It is an indicator. So one of the things that is measured with the truckers, and all the different ranges of blood pressure, what's healthy, sleep apnea test, all those things that they face. But the simple message of your weight matters is one that we convey through a variety of ways in order to really let the public know that it's something that you need to care about. But even that simple 5 to 10% weight reduction has shown scientifically to drastically improve your health. And so it is about health improvement. It's not about anything else. It's about health improvement.
And they can find resources for that on your website. Absolutely. And Kristy, that support is so necessary. And those early steps to make that 5 to 10% reduction can make a real difference.
Absolutely.
Thank you so much.
Thank you very much
for the work that you're doing.